Aminat Medical Monologue, empowering healthier lives through trusted medical education. So a young woman in her late 20s came into the clinic after trying to conceive for over a year. She looked healthy, she exercised, she had no pain, no unusual discharge, no fever, nothing that made her think something was wrong. After a few routine tests, we discovered that she had an old chlamydia infection that had quietly damaged both of her fallopian tubes. Not one, both. She never knew she had it. So just imagine having an infection for months or even years without a single warning sign, and only discovering it when it has changed your entire future. Could that happen to anyone? Yes, it can. And that's exactly why today's video could be one of the most important health videos you would ever watch. Welcome everyone, my name is Dr. Aminat, and this is a trusted home for evidence-based medical education, where we simplify medicine and empower healthier lives. Here, we separate medical facts from myths, answer the questions people are often afraid to ask, and help you make informed decisions about your health. If that's the kind of content you enjoy, make sure you subscribe and turn on the notification, because every week we are making medicine simple and practical for everyone. So today we are talking about chlamydia, one of the most common sexually transmitted infection and one of the easiest to miss. Shocking, right? Most common, but the easiest to miss. So what is chlamydia? So let me paint a picture for you. Imagine someone quietly sneaking into your house. They don't break the windows, they don't make any noise, they don't steal anything immediately. Instead, you know what they do? They slowly damage the foundation while you continue living as though everything is perfectly fine. That's exactly how chlamydia can behave. Chlamydia is a bacterial infection caused by a bacterium called Chlamydia trachomatis. I'm not going to bore you with all of that because it commonly infects the cervix in women, the urethra in both men and women. It can also infect the rectum, the throat, and in some situations the eyes. And the most dangerous thing about chlamydia isn't that it's common, no. It's that most people don't even know they have it. They don't know they have it. So why should you care? Tell me why you should care. So here's a question for you. Would you worry about an infection that causes no pain? Most people wouldn't, because they are fine, they look good, they are not having any problem. And that's exactly why chlamydia spreads so easily, because people who feel completely healthy can unknowingly pass it on to someone else without even knowing. And that's why doctors often call it what? The silent infection. So stay with me until the end, because I'll also share the biggest myths about this infection, the long-term complications many people don't know about, and the best ways to protect yourself. So stay tuned. Now you're asking me the question, how does it spread, doctor? And one of the questions I hear most often is, doctor, can I get chlamydia from toilet seats? The answer is actually no. You can't get chlamydia from toilet seats. Chlamydia is spread through vaginal sex, oral sex, anal sex, sharing of sex toys, and without proper cleaning or protection, or from an infected mother to her baby during childbirth. That is devastating, right? So because of this, that's why we give the erythromycin ointment on every newborn. But here's what it doesn't spread through. It doesn't spread through hugging, kissing on the cheek, handshakes, sharing toilets, sharing food or drinks, swimming pools. So if you've heard any of this, please know that you can't get chlamydia through that. And so don't let myths create unnecessary fear for you, okay? Good. Now, who is at risk? Because the most common conception that people have is that sometimes people think that, oh, that could never happen to me. But I would hate to break it to you that infection don't choose people. They don't care whether you are rich. They don't care whether you are poor. They don't care if you're married. They don't care if you're single. They don't care if you're educated or even famous. Okay? As far as you are sexually active, you can get chlamydia. As far as you're sexually active, you can get chlamydia. And your risk even increases if you have a new sexual partner, you have multiple sexual partners, you have unprotected sex, a previous STI like gonorrhea, because gonorrhea is actually the sister of chlamydia. They both co-infect, or a partner who has an STI. So how do you know that you have chlamydia? Signs and symptoms. Here's what makes chlamydia so tricky. Many people have no symptoms at all. That's dangerous, right? So you have none and you have zero symptoms. But if symptoms appear, these are the symptoms that you should look out for. And I'll be breaking it down on the basis of men and women because we both have different reproductive organs. So women may notice unusual vaginal discharge, excess, burning during urination, pain during sex, pelvic or lower abdominal pain, bleeding between periods or after sex. And for men, you may notice discharge from the penis, burning while urinating, or pain or swelling in one testicle. And if the infection affects the rectum, you may experience pain, bleeding, or discharge. And if it affects the throat, there are usually no symptoms, although some people may develop like a sore throat. So not every sore throat is just a strep infection. You have to go check your doctor. Always do, and that's why I will always advise, go to your primary care physician and get tested. It's best to get tested when you notice some symptoms, and also do yearly testing. So that way you can know your status and help to treat yourself better. Stay tuned. Now, let's separate the myth from the facts. And let's play like a quick game, okay? Myth or facts. So myth, only women get chlamydia. Wrong. Men get chlamydia too. Another misconception myth is, if I don't have symptoms, I don't have chlamydia. Wrong again. Most infected people feel completely normal. Another myth, I can tell if someone has chlamydia just by looking at them. Absolutely false. There is no way to tell just by appearance. Another myth is, my symptoms disappeared, so I'm cured. Not necessarily. Without treatment, the bacteria may still cause damage and even cause future damages that can be very, very, very fatal. So how is it diagnosed? The good news is finding chlamydia is actually very simple. It's quite simple. Just go to your doctor. Your health care provider may recommend a urine test or a swab from the area that may be infected. It's your throat, your rectum, any part of the body that's affected. So testing takes only a few minutes that can save you from a future of having infertility. But it could protect your fertility and your long-term health. You understand? So how is chlamydia treated? As far as it has been diagnosed, it has to be treated. Now, for the real good news is chlamydia is curable. And with the right antibiotics prescribed by your health care provider, most people recover completely. But here is one of the biggest mistakes people make. They start feeling better and then they stop the medication. Just the same way you stop your malaria medication. But that's not good. Please don't do that. Always complete the full course exactly as prescribed. And remember one thing. If your partner isn't treated soon, you could end up passing the infection back and forth. That is another reinfection. Okay? So you want to also get your partner tested or your sexual partners tested and treated. So what happens if it isn't treated? That leads to complications, like I said earlier in the video. And this is why doctors take chlamydia so seriously, because without treatment, the bacteria continues causing damage silently. without people even knowing. That's why it's called the silent disease. And in women, it can lead to pelvic inflammatory disease, whereby blocking the fallopian tube, causing infertility. Chronic pelvic pain, causing infertility, and increase the risk of ectopic pregnancy. That is pregnancy outside the uterus. And that kind of pregnancy, unfortunately, is not viable and sometimes can lead to bleeding and could rupture and cause death of the patient. So it's good to avoid that. Just look at it, a simple infection, but then it's causing ectopic pregnancy and then death of the patient. And in men, it causes epididymitis, which is, and also it can cause pain and also infertility problems in some cases. And in both men and women, it increases the risk of acquiring or transmitted HIV. And during pregnancy, it can increase the risk of premature birth, that is causing premature labor, preterm labors, and babies may develop eye infection or pneumonia even after delivery. And that's why we always screen expecting mothers to prevent this. So how do you prevent it in the first place? The good news is that most cases can be prevented. You have to protect yourself by using condoms correctly and consistently, getting tested regularly if you're sexually active. Even if you're not sexually active, get tested regularly because it's all for your well-being. Having honest conversation with your partner about STI testings and completing treatment if you're diagnosed, and making sure your partner receives treatment too. So what would I say now is that if there's one message I want you to remember today, is this: getting tested is not something to be ashamed of. It is a sign that you are taking responsibility for your health. Okay? And chlamydia is quite common and is often silent, but it's curable. It is preventable. And prevention, as I say, is better than cure. And the earlier it's diagnosed, the better your chances of avoiding a lifelong complication, guys. Just by testing yourself, that few minutes of test. Okay? So what I would be saying at the end of this video is that if you learned something new today, please take a second to like this video, subscribe to the channel, and share it with someone you care about. Turn on the notification button, and also if you have any other topic you want me to talk about, please leave it in the comment section. You never know who might need this information. I am Dr. Aminat. Remember, knowledge saves lives. So until next time, stay informed, stay healthy, and stay empowered.